physiology, biophysics, and molecular medicine. I'm director of the Ehlers-Danlos Clinical Research Program at Boston University School of Medicine.
All right.
I am a licensed physician in the state of Massachusetts, and I am a mandated reporter for child abuse. I do not promote child abuse. So how did this all begin? 1969 at the University of Wisconsin, I was given the responsibility to identify the major circulating form of vitamin D, which I did in 3 months. So if you go to your doctor to get a vitamin D test, I'm the guy that discovered it. Also, a year later, I got my PhD degree. Why? Because I identified the active form of vitamin D that's made by your kidneys. We began to realize that kidney failure patients, the reason they had such severe bone disease, they couldn't activate vitamin D. I'm an organic chemist. My roommate and I was a graduate student. We were the first to chemically make it. And the material that we made, we gave to pediatricians and adult doctors of children that not only had kidney disease, wheelchair-bound, and began to walk again, but also a rare disease of rickets, where these children couldn't activate vitamin D. And what I provided to these children cured them. So by 1972, I was recognized as one of the world leading experts in the field of pediatric and adult metabolic bone disease. 1987, I was recruited by Boston City Hospital, then became Boston Medical Center, to be chief of endocrinology, nutrition, and diabetes. I was director of the General Clinical Research Center, responsible for all clinical research at BU. And they asked me to set up a pediatric and adult metabolic bone clinic, which I did. And I was its director until 2021. How did I get involved in this? In 2010, I received a phone call from a mom, desperate for help. And she said, I need your help. And I said, how can I help? And she said, I have been and my husband accused of child abuse. And I said, I don't know anything about child abuse. I don't know how I can help you. And she said, my son had bone fractures. You're one of the world's leading experts. Please see us. And I did. And I wound up seeing this family and realized that the mom and the child had Ehlers-Danlos syndrome. I have been writing about Ehlers-Danlos syndrome since 1980.
Wow.
We know that this genetic disorder increases risk of fractures more than twofold in children and adults. And so I got to see the family. I went to family court, and actually the family court listened to me and gave the child back to the family. I followed that family for 8 years. Now here's part. I received a phone call from a woman in Minnesota, and she was distraught. And I have a Ehlers-Danlos clinical research program. And I don't just willy-nilly take phone calls and Zoom calls and just assume that, there's no issue here. I carefully vet them. I ask them lots of questions and have them fill out a questionnaire. And so I talked to this mom, and I said, I need to talk to you and your husband. And she said, you can't talk to my husband. And I said, why? So then she told me her story. So she has 2 children at home and a 6-month-old that had a bruise. Her and her husband, who is a fireman locally and captain of the Navy originally, they went to the hospital thinking that the pediatrician would come out and explain what was going on. Instead, 2 detectives showed up, put them in handcuffs, took them to the police station, and interrogated them for the next 8 hours. And so finally the detective convinced the husband, look, maybe you squeezed the infant a little bit too tightly, you were tired one day, you take some parenting classes and everything will be fine. And so he did, he signed the dotted line. And sure enough, he was instantly accused of felony child abuse, wife permitting it, 2 children at home gone, and 6-month-old taken away and put in the grandparents, paternal grandparents' care. The father was so distraught, he didn't know how he was going to get his children back. So he decided there's only one way. So he wrote a note saying, I did this, I apologized, all right, give the children back to my wife, and he committed suicide.
Oh my God.
Oh, that's not the story. Oh, no. She is 12 weeks pregnant. She gives birth, breastfeeding her infant, her daughter. 5 days later, DCF shows up and takes her infant away and puts in foster care. Also, during the time that they were in parental grandparents' care, they developed some bruises, the infant's a child. So now, not only are the parents child abusers, but even the grandparents are child abusers. And they were taken away and put into a group foster care home. She went to court and lost twice. And then ultimately, she went to the Supreme Court, appealed, and finally got her kids back. But she no longer has a husband. I've received over 400 emails requesting my help. I sent off this questionnaire to all, and I've helped well over 100 families be reunited.
Wow.
However, 2015, I kept my hospital fully informed, and they were congratulating me for my help. And then all of a sudden, I got 2 families in Massachusetts that asked me for their help. And I testified opposite the pediatricians at my hospital. So whereas my hospital was fully in favor of my activity, they turned 180 degrees. And I was told that the board of trustees for the hospital and the CEO of the hospital, they said, we've got to get rid of this guy. And so then, even though I'm the world's leading expert in this area, and Google Scholar, I published over 900 publications. I have over 100,000 citations. Meta GPS Scholar reviewed 20 million scholars, 300 million publications, and they recognized me as #1 in endocrinology, #1 in vitamin D, and #2 in the world for bone. However, I'm told by my hospital I can no longer see pediatric patients. And so I gave a Daubert hearing, right, a pre-trial hearing. My expert report was taken by the child abuse expert and sent to a child abuse expert in Yale, who then sent it to my chief. And since they said I couldn't make a diagnosis in an infant, I got the phone call that I'm going to be fired. I went in front of the medical advisory committee, ad hoc committee. They said they were going to terminate me, but then they said, well, they're going to actually put me on leave for 9 months. But they said, wait, because you can go in front of the ad hoc committee for the board of trustees. They didn't introduce themselves. They gave me 15 minutes. And a couple of hours later, I received a letter saying I've been terminated from Boston Medicine. Right? Wow. I remain as professor of medicine at Boston University School of Medicine. I still have my clinical research program. And I have now over 600 DNA samples trying to raise money. We've published 3 papers now on the genetics of Ehlers-Danlos syndrome and mast cell hypersensitivity. Finally, why am I doing this? I'm 79 years old. I have stage 3 prostate cancer, the most severe form. Right? I went to the courts, right? Lost all of my financial welfare, basically. Also, the bank now owns my home. And so my wife, being quite distraught about all this, almost lost my marriage in 53 years. And it was actually a Christmas miracle that saved it, and we are now stronger than ever. congressmen and women listening to this, right, why am I doing this? Right, because my family asked me the same question, and the answer is simple. And I think Senator John Lewis made it very clear. He said, when you know something is wrong, you are obligated to help make it right. And I'm a physician, do no harm, and as a result, even over the weekend, I got 2 more cases. I get a case or 2 every week of families still trying to contact me. So thank you very much for listening to me, and I have a good day.
Our next expert